Hi, this is Brian Kim. I'm going to share with you case number 137 in the best way to do cataract surgery series. This is a hypermature Catarock, and you're going to see terminal chop, cross chop, scissor chop, and mechanical fracturing, all in order to reduce these ultrasonic energy and also to efficiently fracture the lens pieces without having to grab them with vacuum, just crushing the lens pieces between the instruments, and then once they're small pieces, using the ultrasonic energy to emulsify the lens pieces and using the vacuum to remove the lens pieces. So this is a dense lens. You can see how dense it is. I'm using a corneal marker, which will help me to center and size the rhexis. I'm using the cotton tip to steady the eye, and I'm turning the eye towards the left. I'm making a paracentesis incision on the right side and then now on the left side, making sure I'm flat to the iris plane, which creates a nice corneal shelf, which will allow me to achieve a self-sealing incision. This is intracameral lidocaine and then some intracameral epinephrine. And then this is some intracameral air. With these extremely dense lenses, I like to use trypan blue. Trypan blue essentially because in case there is going to be some potential complication, I have good visualization of the anterior capsule. This is the triplanar corneal incision. I make a vertical groove, place the blade into the deep part of the groove, tunnel through the cornea, and then when I'm ready, I turn the eye towards me with the cannula, and then I enter. Because this is a fairly dense lens, instead of going with the forceps, I go ahead and puncture with these cystotome needle here. These are the blunt tip Haldi Perkar forceps, and so I went ahead and used the cystotome instead of putting any stress on the zonules with these blunt tip forceps. So I go around circumferentially, grabbing and re-grabbing, trying to make the rhexis appropriately sized and centered based upon the corneal mark I made previously. You can see I'm just taking my time going around circumferentially, and the trypan blue does help with visualization of the capsule. Go ahead and burp the viscoelastic out. And this is the capsulorhexis hydrodissection technique. I place the cannula under the rhexis edge contra-incisionally, point the tip down, get a nice wave, turn the tip back up, decompress on the left side, and then spinning the lens from the right side, hooking the peripheral lens. Just removing some air bubbles there. Irrigating the surface of the eye, lifting the incision with a chopper, going in with irrigation off to minimize Descemet's trauma. Oftentimes, when you try to remove the surface epinucleus, there's none. It's all very dense material. And so I decided to go ahead and sculpt a trough here, but before I do that, I'm lifting the iris because there's a little bit of a reverse pupillary block effect here. And as I lift that, you can see it relieves that reverse pupillary block. Go ahead and start sculpting. You just want to be mindful about how much you're pushing down on the lens when you do this. I don't really need to go extremely deep because I know that with the terminal chop technique, I'll be able to fracture through and through. So you're just really debulking the lens as much as possible and removing the central dense core. That's what you're really doing. You're able to attack the posterior plate by performing the terminal chop by fracturing, again, from the equatorial plane. So go ahead and I was bevel up when I was sculpting. I switched to bevel down now. I placed the chopper around the rhexis edge contra-incisionally, fracturing the lens from the periphery at the equatorial side, fracturing and then trying to propagate that fracture through and through. But there's a little bit of a Pac-Man effect because of the density of the lens. And again, because I didn't sculpt all the way down, And I don't want to do that because if you go too far down, there's a posterior capsule there, and there's really unnecessary with this technique. Do a little bit more sculpting just to debulk a little bit in the trough. And you get a little bit more efficient sculpting by placing the chopper on the other side as counterforce as I'm sculpting. You can see there's much more control and more efficient sculpting this way. And then now I go ahead back to bevel down, and then I fracture the lens from the equatorial side. Again, that's why it's called terminal chop. And then now you see that the lens is completely bisected and there's no leathery adhesions between the two heminuclei. Place the chopper around the right heminucleus, pulling it centrally toward the phaco tip. The phaco tip is deep in the bag, fracturing the right heminucleus in half, and that is the cross chop maneuver. Trying to separate, there might be some posterior adhesions, but we'll get to that later. Placing the chopper around that first quadrant, fracturing that first quadrant in half. Using a little bit of vacuum to grab that piece up, getting the chopper around the lens piece, and then emulsifying that piece. Again, using crushing forces to sandwich that piece in half and into smaller pieces, and then emulsifying the lens piece. I'm just teasing that second quadrant around with the chopper, placing the chopper around the lens, pulling it centrally towards the phaco tip, and then fracturing that piece in half again. Again, this is all mechanical forces here. Placing the chopper around the lens piece again, getting it around the lens, crushing it in half again, using some vacuum to grab that piece up, again crushing the lens between the instruments. By crushing it between the instruments, that just means I'll be using less overall ultrasonic energy. Again, crushing the pieces little by little between the instruments, and then using pulses of ultrasonic energy and vacuum to remove the pieces. You can see this is a really dense lens, and it feels like you're not making a whole lot of progress, but we are just chipping away little by little at this lens. So I'm going to try to turn that lens piece again a little bit, placing the chopper around the lens piece, and you want to be able to hook the lens. See that? I hooked it. You know that it's hooked because I'm able to lift it up, and then I'm able to crush the lens between the instruments, getting around it again, using some vacuum to grab it a little bit, and then getting around the lens with the chopper. I'm trying to manipulate it, and you see this is a scissor chop maneuver. I'm placing the chopper sideways and then I amputate that posterior adhesion. That's the problem with those pieces. They're all kind of stuck together, so when you're trying to grab it with vacuum, it just releases and you lose that purchase. And so that's why that scissor chop maneuver is really a great way to efficiently get to that posterior adhesion. You see how shiny the lens pieces are. It's just is a testament to how dense this lens is. So I'm kind of manipulating the lens piece and trying to get the instruments around it and crushing the lens piece between the instruments. And I can feel the density between the instruments too. Again, I could just try to go pedal to metal with this, but that's not the way I like to do the surgery. And again, I tell every patient before I do their surgery that I will be doing their surgery as if they were my family member, if they were my mother or my sister, my brother or my dad. I just want to make sure I do as gentle of a job as possible. And time is less critical in these situations. You just want to do a really nice job, be very gentle on the corneal endothelium if possible, and just reduce your risk for complications. So I got that first heminucleus out, I turned the second heminucleus in front of me, and then I'm pushing some more viscoelastic to coat the corneal endothelium. Go back in with the chopper, get underneath the rhexis edge, pull it centrally towards the phaco-tip, fracturing the second heminucleus very carefully in half. You can see it's really got some leathery adhesions there. Placing the chopper around that third quadrant, hooking the lens, and then crushing it between the instruments. Crushing the lens between the instruments again. Using some vacuum to lift that piece up. And then that's it, scissoring maneuver there. I'm just amputating the posterior aspect, turning the chopper sideways in a more horizontal configuration, and then amputating that posterior adhesion of the lens piece. So again, when you're having these dense lenses, the lens pieces are all attached. I use the analogy of like a flower petals are attached to the central core. And so in order to separate the petals from the central core, you can do that scissoring maneuver, which you saw one more time there, just turning the chopper sideways and then just amputating the lens piece between the instruments, as if the two instruments are like the blades of a scissor. They're coming together and just cutting that lens piece. So that was quite a bit of effort. So now this is the last quadrant, placing the chopper around the lens piece, making sure I hook it. Didn't quite hook, and so I then repositioned it with the phaco tip and then went after it again. And mind you, I'm really gentle here because there's no epinucleus, there's no cortex in these cases. So here's the scissor chop maneuver again. You see I'm able to just very carefully, look at that really nice maneuver, just amputating that posterior adhesion there. Because remember, the chopper is about 2.5 millimeters, and the lens thickness is always going to be greater than that. It's like 4.5, 5 millimeters thick. And so every time you chop in these extremely dense lenses, you're not going to get all the way through. And so in order to avoid that Pac-Man effect, or in order to address the Pac-Man effect where there's that posterior adhesion, the scissoring chop maneuver is really nice because you can turn that chopper sideways, get underneath the lens, and then since the chopper is underneath the lens and the phaco tip's above it, you can bring the instruments together and basically amputate that posterior adhesion. Doing it this way, you're not grabbing it with vacuum, you're not going after it with phaco, because if you go after it with phaco, you'll be breaking it up into smaller bits, but you're not really addressing the adhesion that's keeping the two big pieces together. And that's where people get into trouble. They have this big, massive piece and they don't know what to do with it, and they're trying to break it up, but they're having a hard time because they can't, lollipop it. You can't sculpt those pieces because it's rolling around in the eye. And so by using these crushing forces, in my opinion, it's really the easiest way and a direct way to tackle these challenging pieces. So you see those last remnants here, I'm just using mechanical forces to crush the lens pieces and then keeping the chopper deep. So I take the chopper out, push BSS in, take the phaco tip out, and I go in with the INA handpiece. I always start sub-incisionally, peeling the cortex from anterior to posterior. And with these dense lenses, I'm always mindful and concerned about zonulopathy. So I switch to polish mode and polishing under the rhexis edge of any lens epithelial cells. I'm pulsing the subincisional capsulorhexis, which was clean. And then I'm pushing some cohesive viscoelastic to fill the bag. And in this case, I'm using the shepherd polisher. So with the shepherd polisher, you can rotate the instrument and polish for the lens epithelial cells. It does a nice job of being able to tackle the subincisional lens epithelial cells as well. The other end has a Singer sweep, so go ahead and polish in the subincisional area as well. And I'll be putting in a 3-piece lens, so I'm widening the incision. But before doing that, I'm pushing some more viscoelastic to fill the bag, placing the injector in, turning the bevel to the left. The leading haptic goes into the bag. Making sure the optic comes out flat, rotate my hand 90 degrees counterclockwise, and let the trailing haptic come out, pointed to the right. And then I use a Maltzman to dial the trailing haptic into the bag. I'm checking to make sure that the entire lens is inside the bag. Both haptics are in the bag. And then I go in with the INA handpiece, activate irrigation, go underneath the lens, removing all the viscoelastic from within the bag. Polishing under the rhexis edge, and then removing the viscoelastic from the anterior chamber, and then I'll hydrate my incision. So again, this is a hypermature cataract with such a density that it would lead to a posterior plate. And so I debulk the center by sculpting and creating a trough and essentially a stop and shop technique. But instead of cracking from the top, which is really much more prone to a Pac-Man effect where there's still an adhesion in the deep aspect of the lens, you perform this terminal chop, we're able to fracture from the equatorial side by placing the chopper around the lens completely. And even though I didn't get through all the way, I rotated 180 degrees and performed the same maneuver. I held the lens with the chopper as I sculpted for more efficient sculpting, because when the lens is so dense and there's usually weak zonules in these situations, the lens just kind of moves away from you as you're pushing down. So this was a much more efficient way of sculpting and then performing cross chop to fracture the lens pieces without having to spin the lens anymore. And then again, that scissoring chop, anytime you have a posterior plate, you're able to turn the chopper sideways, get under the lens, and then because the two instruments are around the lens piece, you're able to just crush the lens with this scissoring maneuver, as if the two blades of the scissor are coming together and then amputating that posterior adhesion. And so to me, this is a very efficient way, very controlled way, and a minimal ultrasonic energy way of disassembling a hypermature cataract. And as you saw at the end of this case, the cornea centrally is still quite clear, And post-op day 1, this patient looked really great. So I hope this was helpful to you, and I thank you for your attention.